To my channel once again. Today we are going to look at intravenous fluids, specifically crystalloids. So what are IV fluids? IV fluids are sterile solution administered directly into the bloodstream to perform the following functions: to maintain or restore fluid volume, to correct electrolyte imbalance, to support circulation and tissue perfusion. IV fluids are broadly classified into crystalloids and colloids, and then some classification include blood and products that have to do with the whole blood, fresh frozen plasma, and the packed cells as well. So here is a simple diagram based on classification of IV fluids. We are not going to talk about all this. We are going to focus on the crystalloids only. So we'll move from here to the next slide. Let's look at the crystalloids. So what are crystalloids? So these are solutions that contain small molecules, that's electrolytes or glucose, that easily pass through capillary membranes, and then they distribute quickly between intravascular spaces and interstitial space. They are most commonly used IV fluid in nursing practice. So examples are normal saline, Ringer's lactate, and dextrose solutions. So let's look at a brief note on colloids before we continue with the crystalloids. So the colloids contain large molecules, that's protein and starch, that remain mainly in the intravascular space. Example is the albumin, dextran, gelatin. And then to note, colloids are mainly used to expand plasma volume, but are less commonly used due to their cost and then potential side effects. Move back to our main focus, crystalloid fluids. So crystalloid fluids are classified based on their tonicity, which refers to the effect of the fluid on cell size compared to plasma. Crystalloids are grouped into isotonic, hypotonic, and hypertonic. Proceed. Let's look at the concept of tonicity. So tonicity refers to the effect of an IV fluid on cell size compared to plasma, as we said in the previous slide. Now, tonicity determines whether a fluid will stay in the blood vessel, move into a cell, or move out of cells. Let's look at the concept of osmolarity. Osmolarity refers to the concentration of osmotically active particles, that's the solute, in a solution and determines the movement of water across a semi-permeable membrane. Let's look at the clinical significance of osmolarity. But before then, let's give a broad explanation of what we said. So tonicity has to do with the movement of the fluid either into the cell, outside the cell, or there's no impact of movement. But with osmolarity, it has to do with the concentration of solutes that is in the solution that will now cause the process whether the fluid will move into a cell or move out of a cell, or there will be no movement. Okay, so let's progress to the clinical significance of osmolarity. So an increased osmolarity will cause a cell to get dehydrated and then will cause what? Thirst. A decreased osmolarity will cause cell swelling and a risk of cerebral edema. So back to our main focus, let's look at the first group of crystalloid fluid, which is the isotonic crystalloid fluid. So what are they? So this fluid have an osmolarity similar to plasma, meaning with that kind of osmolarity or concentration of solutes, which is more closer or similar to plasma, there is no net movement of water into or out of the cell. So this fluid basically remain intravascularly, so they have no effect on the cells. So simple, with this, the cells remain the same. The cells remain the same. Let's look at some common isotonic crystalloids. We have 0.9% normal saline, we have Ringer's lactate, and 5% dextrose in water. So simply, if you are given a question and then they are asked to pick the odd one out, which of the following is not an isotonic solution crystalloids, you should know which one to pick. Look at the effects of this isotonic crystalloid fluid in the body. So they expand intravascular volume, explained earlier. They improve blood pressure because it is intravascularly stable over there. They support circulation, meaning they are intravascular, they are going to be in the intravascular plane, so they support circulation, distribution of what fluid across the body. Then they does not cause cell swelling or shrinking since their osmolarity is equal to that of the plasma of blood. So there's no movement into cells, there's no movement out of the cells in the body. Common uses. So they are used for fluid resuscitation, that's when there is shock as well, blood loss, and then post-operative patients, then dehydration. Things to consider: you have to monitor for fluid overload because when this is given more than necessary, it's going to cause fluid overload and then going to give extra work for the heart to do. And then you have to assess for lung sound and edema because once there is lot of fluid in the system, can actually cause pressure on the heart, and maybe the heart can't actually pump enough blood at that point in time, so there can be a backflow of blood into the lungs, and then at the end of the day to seep out to excess tissues around the lungs. And then when there is edema, meaning fluid that already seep into various tissues in the body, more of this fluid can increase pressure intravascularly, still causing more fluid to seep outside of the vessel and then causing more edema. Then they have to use consciously in patients with heart and then renal failure because in this condition there is already fluid accumulation in the body. So pumping more of this intravascular fluid over there can worsen the case because here the kidney can't eliminate more fluid and the heart can't also pump well as it used to do. For your time, we stop here for today, and then in the next presentation we'll talk about the hyper and the hypotonic crystalloid fluids.